Welcome to today's brief section on academic clinical fellowship. This will mark our section for the mentorship, and I'm pleased to see every one of us here. So this first section will just be about what the academic clinical fellowship is all about. That's ACF. Then the second section will try to have an interaction amongst us, how we want to progress with the mentorship, what you would like to gain from there. And the last thing would be any questions at all you want to ask, and we will be able to respond. Thank you. So, by way of introduction, ACF, it's an NIHR funded program and it's a clinical specialty training post in medicine. So in bracket, all specialties that incorporates academic training. So whatever specialty you find yourself, be it in surgery, medicine, public health, you can get up to 75% of your training in that specialty and 25% of the time of your training in research. So recruitment is via the integrated academic training program. Usually each local NHS area would have their integrated academic training program, which is based within that local area. For instance, it could be region of the north, say northwest or northwest east of England. Uh, for me to just backtrack a bit, ACF program is mainly in England. I'm afraid to say that. So if you're interested in this, it means that you're ready to move from wherever in the UK back to England. So his standard duration of ACF is 3 years and up to 4 years for GPs. So what this basically means is that for you to do an ACF in a specialty, take for instance a specialty that is 5 years. The first 3 years of that training is considered as your ACF. The remaining 2 years you will no longer have the academic component to it. Say, for instance, you're in public health, permit me to use public health, for instance, it could be any other specialty. So it means that the first 3 years of your specialty training, you would have 25% of that component of specialty training for research. So which would mean that 4 days out of five, 4 days in a week, you are doing your specialty specific training, whereas one day in the week you're doing research training. Usually, ACFs are affiliated with academic centers, mainly universities. So you will find out that when you are applying for it, it will tell you the principal investigators who are heading the ACF based in universities. Some people do a number of combinations to get the 25% of their um, research training. So it could be one day in a week, or it could be 3 months in a year, or it could be 9 months at once, because that's what 25% in 3 years would turn out to 9 months, depending on your specialty and depending on the arrangement. So there can be some level of flexibility. And also for the GP training, we find out that it is 4 of 3 years. I don't know why, but anybody who is entering ACF in GP would likely do that 4 years. And it gives you access to master level training to develop academic skills. So this is essentially a pre-doctoral program when you're doing the ACF to help you develop the research skills that you can use to put out application for a PhD fellowship if you're interested. But there is no guarantee that you may be able to get a PhD fellowship after your ACF. So when you're done with your ACF, if you don't get a PhD fellowship, you just continue with your training and finish up. Um, your whole time will now be 100% in your specialty. But if you do get a PhD, you want to go and do that, you can go out of program, finish, and come back. So that's the ACF thing. And usually each year you will have around 200 plus slots scattered around all the regions in England and across specialties. Something that we need to know is that ACF is highly competitive and it is multi-specialty recruitment. So what do I mean? You can have one post or two posts that will be applicable to multiple specialties. So let's say one post is available for specialties for those interested in GP and those who are interested in maybe pediatrics, and it can also be multi-level. So that one post can also be available to ST1s, ST2s, and ST3s. So that makes it so competitive that you're not only competing with other specialties, but you're also competing with people in different levels. So if you're entering into ACF at ST1, there are things you need to have. If you're entering into ACF at ST2, there are things you also need to have also in ST3. That's just the things you may need to know. And the recruitment window usually will be from October. I don't know when this year's own will start, but for the past few years, it's been beginning of October to the end of October. So the application window starts, and you're expected to apply to Orel. Some of us may have had access to Orel and know this is the NHS England training recruitment website. So if you haven't got, it's one of the things you need to do to register there. When the application window opens, you see all the ACFs advertised there, and you can apply the same way you apply for other national training posts. So between November, February will be interviews. So people will be shortlisted after the October thing. When you have finished applying application deadline, they will shortlist. And after the shortlisting, if you meet up with the shortlisting, you will be invited for interview. And in January, they usually will give their initial offers, and there will be a whole deadline. So some people might be expecting ACF in other other specialties, or they might also be interested in other things. So they will give you a specific time to hold that's your that's your offer. And if peradventure the post is not filled, there is an opportunity for advertisement of that post. So usually they don't want anything to waste. If any post for any reason was not filled, it will be re-advertised. So why you need to get ready, even though it's August, even though it's October that usually they will start, is because there are many things you need to do. So you need to prepare yourself. The paperwork is enormous that you need to appear competitive. I've already mentioned to us it is specialty and multi-level application. So that means that if you're going in for ACF, you really would be mean business. So it's no less competitive than national recruitment. I would even think that it might be more competitive because of the way it's arranged. So these are the eligibility criteria. So it's open to individuals entering medical specialty training and those currently in medical specialty training registrar posts and hold an NTN, or NTN is national training number, or GNARI registration number. So this is open to those who are medically qualified. I've said it's multi-specialty. That's why they said it's also open to registrars who are already in training. So, for instance, if you're in your ST2, that's your year two in training, and you want to do an ACF, it's still possible for you to move from your national training to ACF. And applicants would not normally be expected to hold a PhD, so or other higher degrees, but this is usually a plus. So when we begin to go through the mentorship thing, you will find out that one of the scoring criteria will be the highest educational qualification. So if someone has a PhD and masters, they are at a higher level than someone who just has MBBS and no masters. And application I've mentioned already is via oral. So shortlisting and interview. For shortlisting, they have standard checklists that they use for shortlisting, which makes HCF uh, a bit a bit of more predictable. So the shortlisting and the interview, they have it. So in one of the if you've gone to the website, they would have appendix at the end of the website of this where they've talked about the NIHR ACF postings. So in appendix 5, they've listed the checklist for shortlisting people, and those checklists they usually will follow it. I mean, most times they follow it. I'll say this is not prescriptive, but people are encouraged to use that. And part of what we're going to be doing in the mentorship is to go through this checklist. You look at the checklist and see where you are and see what you need to do to appear more competitive. And applicants must be medically qualified. I've said that and provide evidence of clinical competencies appropriate for the ST level. You're just going into ST1, the usual CREST form that they will ask for. You should evidence that, except you have done your foundation program in the UK. If not, you have to produce a CREST form. That's certificate of readiness to start training. I think that's what it is. If it is not, but it's the certificate that shows that you're ready for training. And if you're already in if you're already a registrar, you need to produce what they call ALCP. So it's more like annual review of competency progression. Usually, if you're in training every year, you review your competencies to be sure you're making progress. So that's what you will evidence if you're already in training to show that you're making the right level of progress. And ACF interviews usually will be 30 minutes. So if you're shortlisted, the ACF interview is usually 30 minutes, and it will follow the interview evaluation form. So it's in Appendix 6. Usually, they have itemized the questions. I think there are around 6 questions that they usually will ask. I don't know whether it's 6, but within that range. What you just need to do, I mean, this practical expo I'm giving to you, is it an expo? It's an open secret though. Um, if you have been shortlisted and you go through that template, memorize it, do whatever that is there. That's that's what is expected of you. They don't usually would deviate except for maybe other reasons. But having gone through that and seeing other people mentored go through that, it's usually the same question. So the other thing that you need to know is what we call clinical benchmarking. So the ACF application has 2 forms of recruitment. So the first recruitment is this academic bit I've told you that you need to evidence using your Appendix 5 and Appendix 6 I just talked about. The other thing called clinical benchmarking is whichever specialty you're in, you would have done their exam for that specialty and appear appointable. So let me read what is there. It said applicants without appropriate training number will need to demonstrate their clinical competencies for the ACF post at clinical benchmarking. Clinical benchmarking relates to applicants reaching the threshold of appointability at the national standard clinical interviews or assessment for the GMC specialty and level of ACF post to which they are applying. So the simple explanation of this is say for instance, you're going for ACF in GP, and GPs, if they do MSRA, I'm sure they do that, which they used to get into GP training. What clinical benchmarking means that you must do the MSRA, but instead of the ranking that you follow for the GPs, all they want you to do is to get to the cutoff points. If the GPs say, I don't know how the MSRA cutoff point is calculated, but if their cutoff point is say 50%, for instance, and you got 50%, that's all they want you to do for the clinical benchmarking. So where your ranking is from usually would be from the academic recruitment that we have just finished. If you have done the academic recruitment, you have to do your clinical benchmarking. The reason is because you need to appear clinically appointable because they are going to train you in the specialty, and also they are going to offer you a national training number. So you also have a national training number as an academic registrar. The only difference is that there is a suffix they usually will put to show that your own training is you're an academic trainee or academic registrar. So that's what they call clinical benchmarking. So if you're going to be doing ACF for from October, it means you're also going to be applying for the specialty, relevant specialty of that relevant specialty that you're interested in. The other thing that changed last year. Before, you could apply to as many ACF posts as you like, but last year's ACF was just restricted to three applications. So you choose only three to apply. I don't know what happened, why it was like that, but it limited the number and the options people had to apply. I don't know whether it made it more competitive or it made it less competitive, but that's what we got last year. And that's the reference that you can look up the whole thing about ACF. Usually every year they will update it. So this is for 2025. And when we get into the platform to have our discussions, um, you would have more information and more guidance. Thank you for listening. And I will open the floor for your questions. So this is the time to ask question if you do have any. Thank you.
Good evening, Dr. Kalu. Sorry, my hand is raised. I don't know if I can go ahead.
Please go ahead.
Okay. Thank you very much for, the video you posted and this one. I think watching it, the first video gave me a deeper insight, and then you talking about it in a smaller bit today has really helped. So I just want to say thank you. And I just wanted to ask, for instance, for someone, okay, for me, I haven't like practiced clinically for a while. What do I need to make me eligible? Because I know that in the video that you posted, there was a part about balancing clinical and academics and all of that. So what do I need to make me eligible to apply for this? Hello? Sorry.
Can you hear me?
Okay, yes, it was breaking. It was breaking, but I
Okay.
can hear you now. Yeah,
Okay. So, what will make you eligible to apply it if you're
yeah.
medically qualified? So
Mm-hmm.
you have GMC, and if you're fully GMC registered,
Yeah.
then you can provide a CREST form.
Okay.
So that CREST form is what shows that you have done your um, basic foundation year, you're able to do a number of clinical things. So,
Okay.
irrespective of the specialty, even if it's in public health where
Yeah.
you're not likely going to be doing any clinical thing, you need to still
Mm-hmm.
evidence that you have done your foundation year program. So, for those who are in the UK, if you have done your foundation program, that's all you need. But if you trained internationally, if you're an international medical graduate, you need to
Mm-hmm.
evidence that by producing a CREST form. So that's what will get into long listing. There is actually three
Yeah.
stages to that. You get long listed, then from long listing you get shortlisted. If you now
Mm-hmm.
meet what they have itemized in the Appendix 5 checklist, And
Okay.
if you are successful through the Appendix 6 checklist for interview,
Mm,
you are now
mm,
appointed into a post. So if you are appointed into a post, it's conditional until you benchmark, and that
okay.
benchmarking is doing your MSRA if you're in clinical specialty, or
Mm,
going through, if you're in public health, you have to go through your assessment center and go through your selection center and get appoint and be deemed appointable into public health. So I
mm,
guess each specialty has its own requirements.
okay. And all of this we'll find in the appendix. For instance, for public health, we'll find what we need to do before then.
So, uh, for the academic components, it's generic really. So
Okay.
it's only in clinical benchmarking that you now write the specialty specific exam.
Okay, I'm
I would
asking like
say
for public health,
yes.
is there any exam that we need to write or something to show that we are appointable before the the application starts?
So there's no exam to
Okay.
before the application starts. What
Mm-hmm.
you need to do, the same thing I mentioned about being GMC registered and also
Okay.
providing your CREST form is for everybody.
Okay.
So that will
Okay.
get you long listed.
Mm-hmm.
And the shortlisting criteria is
Mm.
also the same. Remember, I said it's multi-specialty. So, for
Yeah.
instance, if someone in pediatrics is competing with, if people in pediatrics are competing with people in public health, you
Mm.
won't, if you don't have a generic thing, you might be biased towards a particular specialty. So,
Okay.
they made it in such a way that the standard is for every specialty.
Mm.
Where you now have to become specialty specific is if,
Mm.
for instance, you have now been conditionally appointed into an ACF post and you need to benchmark and you're in public health. So you have to have passed the exam, the national recruitment exam that takes people into public
Mm.
health. So you
Okay.
need to have gotten the cutoff point. It's just the cutoff
Mm-hmm.
point that they need you to get. You don't need
Okay.
to now compete with other people who are in the national training pathway, if that makes sense.
Okay. It does. It's
Okay.
clearer. It's
All right.
clearer. Thank you.
I'm,
Thank you
I'm
very much.
happy it is. Yeah, you're
Mm.
welcome. Any other question, please?
Chief, yeah, thank you so much for this opportunity. Please, I wanted to ask, is there a cutoff? What's the cutoff for the specialties? I tried to check for public health and GP, but I don't really I don't think there's anywhere where it's clearly stated that this is the cutoff for these specialties. I just want to know.
So I don't think they usually will have any static cutoff point.
Okay,
It's dependent on the year and the cohort.
okay,
So their performance will determine where the cutoff will be. So you won't find it anywhere. Usually, when people have gone for the exam, they will tell you your score and tell you what was the cutoff for the exam, if you get what I mean. So
okay,
it's not stated anywhere that this is the cutoff for, say, GP public health. I haven't seen, but what I'm aware of, having gone through the process, would be that if you've written your exams, they would say maybe you scored. They will give you your T score. I don't know what it's all about,
okay,
or it's a way
okay,
they determine it. They'll give you your T score and tell you that certain number of people were below you. This is the percentile you are. This number of people were below you in their performance, and this was the cutoff. So usually, what the advice would be is try and consistently rank very high in your preparation for the clinical benchmarking.
mhm, okay. Then secondly, Chief, if you've written this exam in the last round, can you transfer your scores from that round to this round? Is that possible?
You mean ACF?
I mean for the public health assessments or the MSRA.
I think that for public health, it's just once a year.
Okay.
And so if you have, for instance, if you are appointable for the ACF and did not uh, you did not successfully benchmark, you would lose the ACF post. I didn't mention that. So you must have these two to be able to take up the post. So that clinical benchmarking is very important for you to take it up. Because public health, for instance, is recruitment is once a year. If you haven't successfully benchmarked, I'm afraid you won't be able to have opportunity, have a go at it again. But I think that in the Q&A, there's something they said about if it's the same cycle and you have clinically benchmarked, for instance, if it's a GP, I think GP they do like two times, maybe I think so. They do their
Yes,
recruitment two
twice.
times. So if you have uh, done ACF before and within that space, I don't want to give us wrong information, but there's
Okay.
something that you can do with whether you are able to um, use another another the subsequent one to still apply. Well, it's stated in the NIHR websites in their Q&A question what you can do, but because public health is just once in a year, the recruitment is once a year. So if you miss that clinical benchmarking, you won't be able to take up the ACF post because the next round will now synchronize with the next year's application.
Mm.
If that's
Thank you.
yep.
Okay.
Okay. Another question I had when I was listening to the your YouTube that you posted, for the, just looking at how to get ahead and plan, you talked about teaching certifications. Does it matter where you get it from? And does it have to be at degree level, or it can just be a certificate that one can get on teaching?
I don't think it matters where you get it really, because educational settings should be accredited for quality assurance. So it
Okay.
doesn't have to. I don't think it matters, and things like diploma in medical education or education, those things are teaching qualifications.
Oh,
So
okay.
even if you even have a teaching certificate, that's
Mm,
still also acceptable. I think it should be acceptable as a qualification. And there are other things they do in the UK, might be also, they call it fellow of higher education, advanced higher education or something.
mm-hmm.
It's more like fellowship, but it's in education. And
Okay.
some people go ahead to become associate fellows, and some people become F fellows and principal fellows or things like so. It's more like fellowship, and you have to do a number of things to get in there. For instance, I just had um, formal teaching experience. I was lecturing as honorary in one of the universities in Scotland. So I was honorary for one of their degree program, and I did
Mm,
a certification. They called it designing and training online course. So that's what I wrote. There are a number of
okay.
pieces you write. That was why I wrote that. Okay, so I've been teaching. I taught in med school
Yeah.
at taught fellow students in med school,
Okay.
organized tutorials, um, organized mock, some steeplechase or things like that. Then, as a doctor, this bedside teaching
Mm,
for medical student nurses and colleagues.
okay.
Then now I'm teaching in Go University. I've done this. I've taught this course and
Okay.
assessed them. I am assessing a master's degree dissertation. I'm supervising dissertation, and I've also gone
Mm,
ahead to do this course, the
okay.
designing and training online course. So you can people have different trajectories. So I'm
Yeah.
just saying the things I had spoken to them about, and
Yeah.
I don't
Okay.
know whether I was able to convince them or not. But here we are. Yep.
Okay. Because when I listened to that YouTube, of course, I made a long list, and There were many things that were missing. So I ran to Coursera and I saw that they have some teaching courses there, that give certification. So I wanted to find out if it was one of the avenues that one could use. But yeah, thank you.
Put it on the stone. I know they would say, do they have formal teaching qualification? And the score is like 3 or so in that checklist. But um, I feel they also have um, human qualities or attributes to their marking. So if you
Mm,
are saying, these are the things I've done, I'm doing this, I'm in the process of
yeah.
doing that. So
Mm,
it can also, the person can be convinced that, okay, so this
yeah.
person is doing something teaching wise. Yeah.
Okay. Okay. So just again, one last thing. For instance, whatever we're doing, the first step kind of has to be that we get like the qualifying exam to which of the specialties we want. So if it's public health, we have to make sure we've written the exam that allows us to practice. If it's GP, we must have written that exam as well and all, right? Would- Hello?
When you ask, I can hear you. I can hear
Oh,
you.
okay.
Can you hear me?
Okay, yeah.
Yeah.
Yes,
Yeah.
yes, yes.
So I think maybe I haven't explained myself well because you've asked
No,
this
I think
question.
you have. I think you have. I just need to clarify because with the ACF, right, what it's attached to a training, it's to a specialty. So it's either public health or pediatrics or GP, something like that, right? Okay. So what I'm saying is, for instance, the next cycle is in October, right? So if before October, I don't know whether it's me, but I can't hear you. I don't know if you're talking. Oh wow, maybe it's my network. Uh okay, maybe I'll just wait a little because I don't know. Let me just allow somebody else ask. Okay, yeah, I can hear you now. So what I wanted to say is, so let's say the next cycle is in October. So if by October, for instance, I haven't written the exams that would qualify me to practice as a public health specialist or a GP, then I cannot apply for the ACF. That's what it means, right?
So the ACF actually aligns with when other specialty training applications will be going on, if you
Yeah.
can hear me. So,
Yes, I can.
um, so for instance, the ACF application is usually in October.
Mm-hmm.
Public health will be in November, and
Mm-hmm.
other ones will just cluster around October, November, December.
Mm-hmm.
So it's unlikely to miss the clinical benchmarking because all of them will be happening at the same time. So they time it in such a way that you are able to do the two, if you get what I mean.
Ah, okay. No, so I'm not talking of the application now. I'm talking of the exams that gets you ready to apply. For instance, if you want to go into public health training, there are assessments, right? Eh, Okay, sorry, my network. I think it's my network. I can't hear you, but it's all right. Let me just thank
Can,
you.
can any other person hear me?
It's I think it goes on and off, so I'm not sure whether it's my side or on your side, but most probably my side. I'm in Africa.
Dr. Call, I think sometimes you just cut off. So,
Pardon?
so I can hear you, Dr. Call, and you just cut
Okay.
off. So,
Okay. Okay. So what I was saying is that the exam you write for your specialty usually will come after the ACF application.
Okay.
So so if you're applying for, say, public health ACF, the clinical benchmarking, which is the exam that gets you into public health, starts
Mm-hmm.
the application round from November. So the ACF deadline is already over. So
Mm.
it's not, it doesn't come before that. So
Okay.
if you're applying for any specialty, you should
Mm.
target the clinical benchmarking for that specialty as well.
Okay.
which usually
Okay.
would happen around the same time. Yep.
Yeah. Okay. Thank you. Thank you. It's very clear now. Thank you, sir.
Okay, you're welcome. Any other burning question before we wrap up? Okay. So um I'll stop recording now and we'll just talk about the other things that we want to do.
One more
Let's
question, Chief. Sorry. With an ACF, does it give you like sponsorship? For instance, in public health, because I think the public health training doesn't give that. But if one gets into ACF for public health, does it give sponsorship?
point of correction. Public health gives you sponsorship, even if it's not ACF.
Are
Yeah,
you serious? The myth is that there's no sponsorship with public health because it's open to both clinical and non-clinical, and so it doesn't give sponsorship.
except if the rule changed yesterday or today that we're
Okay.
talking.
Oh,
You know,
great.
because I've got my colleagues who are in public health national training and they are not British and they have been sponsored.
Okay. Thank you.
So so you can see on the chart that they sponsor everyone.
Oh,
That's
okay, great. Thank
okay.
you.
You're welcome. So stopping the recording now.